Um, we're going to do one trivia, and then we're going to move into our next presenter. You ready, Sade?
Yep.
I hope you guys were listening earlier, because
You
I
wanna
think
read
it
it?
got something to do with what was said earlier.
You want to read it?
No, you read. I can't even see it.
Okay, so if anyone remembers my presentation, what does pH stand for?
Whoever raised their hand first.
Potential for hydrogen?
Yes, sir.
Okay.
All right.
Potential for who?
Hydrogen.
Hydrogen. Okay. Somebody was listening here. All right. Thank you so much. Our next presenter is Dr. John Urich. John became a certified acupuncturist in New Jersey in 1986. He co-taught continuing education classes and basic acupuncture for physicians and dentists from 1986 to 1988 in New York City. He created and ran an acupuncture detox clinic for crack and cocaine abuse in 1991 in Trenton, New Jersey. He is the former Dean of Clinical Studies of Eastern School Acupuncture in Montclair, New Jersey, leaving in 2001. Ever since establishing the Lawrenceville Acupuncture Center in 1988, he has continued to treat patients full-time and now currently practice along with his colleague, Andy Snyder. I'd like for us to welcome Dr. Urich.
Thank you, Brenda. So, I want to demystify acupuncture today and try to make it very simple for everyone so they can understand how it works and what it does and how painless it is. So, I guess you don't really need to follow. There is a write-up in the handout with an overview of what I'm going to talk about. It's on about the fourth page to the end. It says Lawrenceville Acupuncture Center, and the first thing says, what is acupuncture? Found it. Just to help you stay with it. That's all. So what is acupuncture? It's the insertion of fine needles into points on the body to help to balance the body to stop pain or cure an underlying disorder. And I want to show everyone, that's an acupuncture needle. I'll show you how fine.
It doesn't hurt.
Yeah, it's very fine. So people are always scared that they're gonna hurt. I'll show you. We're gonna do a little demo.
Uh-oh.
Very fun. So, it says acupuncture is insertion of fine needles into areas of the body to create balance and encourage the body to heal itself. So how does that work? It works with the energy of the body. It's something we don't grow up thinking about, but the Chinese figured out that energy exists a long time ago. And they developed Tai Chi, if anyone's ever seen that type of martial arts, all based on the circulation of Qi. And the Chinese, they didn't have technology 2,000 years ago, so they watched heaven, the sun came up every day, it got warm, it created growth on the earth, and they said these are different energies. So they attributed the sun or the heat to yang energy, and the earth or growth to yin energy, and they said yin and yang have to connect or interrelate, and man's stuck in between, so somehow that energy has to flow through us. So they developed a series of energy lines that go from heaven down the back of your body to earth, and then back up the inside, on the inside of the body back to heaven, so the sun and the earth could communicate and therefore give us vibrancy, give us chi. So it's very interesting how it came about, and they watched animal movements, and that's what a lot of the martial arts are based on. So now what did they do? They didn't have these sophisticated needles, so they found out like certain areas on the body would help to cure a disease. And then eventually they figured out these areas relate to different organs of the body. So the energy lines, the main one that you see on the chart, there's 12, and they relate to the internal organs. So if the first one is the lung channel, we'll say, and it travels up the inside of the arm, to the face, to the chest, and then, let me think how this works. Oh yeah, it flows down, and then the large intestine flows up to the face, and then the stomach channel will flow down to the earth, and then the spleen flows back up, and there's 12, so you end up with the liver channel, flows up, connects to the lung, so it's one big loop. So, in other words, if you go in a room and turn on a light switch, the light goes on over there. It's the same thing. They'll treat a point in the foot, and a headache can go away because it's the pathway. Okay? Does that make sense?
Yes.
So, on the first paragraph, we're still there. Very thin acupuncture needles, or heat, or massage, or cupping. I didn't bring a cup, but it's a suction cup. For like muscle spasm, we'll put it on, and it helps relieve the spasm or bring circulation to the area. And all these things work to create circulation in the body, to restore the body to balance and to create health. So the second paragraph is the needles are placed along meridians, which are these pathways where energy flows. And then there's points that we combine for specific treatments. And then in acupuncturists, we use diagnostic techniques. So there's many ways to diagnose. Mainly, we look at the tongue, we feel the pulse, and there's specific pulses for each organ. And then we come up with a diagnosis. So you come in with shoulder pain, and then I'll say, okay, your body feels pretty good, but the large intestine's blocked. Oh yes, I don't go to the bathroom every day. Okay, so we know there's some intestinal blockage, but the large intestine channel runs right through the shoulder. So then we have a hint to treat the abdomen as well as the shoulder to create a cure that lasts. Rather than just treat the pain, we can treat something underlying to balance the body so it becomes healthy again. And there's other ways, like the different seasons have different energy. Right now, springtime, so it's the season of the liver. So you see a lot of vertigo. I see a lot of patients with that, sciatica. All these things have to do with the wind or the liver or the springtime. In the summer, different diseases. It's usually spring and fall. I'll see the most diseases. And the most people come in with the same thing. Like 1 week, I saw 3 sciatica in the exact same area. They all came in. So it's interesting how nature, again, affects us. So if we stay healthy, then we can live in balance with nature. If we're eating wrong or not exercising or doing things incorrectly, not going to church, or not having a spiritual part of your life, you can get imbalanced and then you get disease. So, and then along with acupuncture treatment, you'll be given basic ideas about changes to make to your diet and lifestyle. So the Chinese love a warm cooked food because the body's always 98 degrees inside. So they say put things in that are warm, it's easier. So you throw in cold things all the time, it closes the body down. Because the body's 98 degrees, think of that. When you're outside and it's 98, you don't want to be out there. It's too hot. But your body's always 98 degrees. So if you drink warmer things, not icy drinks, or tea, even room temperature water, it's much easier on the body and it creates a lot more health. And I think a lot of weight loss, if people would quit taking so much ice and so many salads, it would help them to lose weight. Because their body would digest things more efficiently, and then your metabolism would increase and you shed weight. It's interesting. So, of course, the needles are always sterilized and disposable, so you don't have to worry about infection. And then quickly, to become a licensed acupuncturist in New Jersey, you need 4 years of college, and then a 3-year acupuncture program, and then take the state boards. And the boards are given by the Board of Medical Examiners. And once you pass that, you can be an acupuncturist. So that's quick, and I have a website address on the bottom. If you have questions, it explains a lot more in detail. But I'd really like to open up to questions or comments about acupuncture. I'd be happy to answer. If anyone has a problem. Yeah, first. Go ahead.
Can acupuncture help with the shoulders, with rotator cuff problems, with the rotator?
That's interesting. Let her talk first, because Shirley and I talked before, and then I'll tell you.
Yes.
You had rotator cuff,
I
frozen.
had a frozen rotator cuff, and I don't even mind it. I had a frozen rotator cuff, and it was very excruciating pain. And what's so ironic about it was that I was complaining about it, and I happened to work in customer service somewhere, and the customer, I don't know, her spirit must have came down, and she said to me, whatever you do not go for surgery. Don't let anybody have you go through the surgery. So I started going through a physical therapist, and I'm talking about session after session after session. And I was not getting the relief that I was had wanted. I was flipping through a prevention magazine, and there was an article that was on acupuncture, and I started reading about it. So I said, for my insurance company paid for so many visits for me for a year, and I decided to go to an acupuncturist. Out of 2 sessions, I have been pain-free and have complete movement in my shoulder. I've had another issue in which my lower back was bothering me, and once again, I was having a physical therapist trying to deal with that. I said, forget this, I'm going back to an acupuncturist. And now I am a firm believer that when I'm in severe pain, I don't even deal with my medical doctor, I go to an acupuncturist. That's what I do.
Yeah, it really works. But what happened? She had frozen shoulders, so there was a lot of congestion, and she couldn't raise her shoulder. She's not my patient, but you see this a lot in the office. Yeah, exactly. So there's all that congestion. So by putting needles not only in the shoulder, but even there's a point mid-leg. I put it in here and I say, because it opens the channel right to the shoulder, say, raise your arm, and they look at me like, what'd you do? Yeah, it's hilarious. But it's good.
But does it, I have a very low tolerance for needles. So as far as pain, when people say it doesn't hurt. Now, some people, I mean, I had some nerve down with those similar needles.
No,
And
EMG.
yeah.
Did you see that needle?
They said it didn't hurt, but it
That's
hurt
not
me.
EMG.
So does it hurt?
I can say that it does not hurt. Yeah, it does not hurt.
I can say also doesn't hurt.
I'll put a needle in you if you're not scared. And I'll show you that it doesn't hurt. I'll do a point right here.
No, don't feel it.
That goes
You don't
to you.
feel it.
You want to try?
Yeah.
Stay right there.
You went in and noticed all the big tennis. She heard about it. You were not relaxed, that's why. You wasn't relaxed.
Try not to text because you fear the unknown.
I might scream, but.
It's not like an injection.
No, nowhere near.
I had some in my hand because I got nerve damage.
Yeah.
It hurted me. Yes, it hurted me severely.
No, that was it.
Try to get there.
No, and you could leave it, it's just the shoulder.
Yeah.
Look, that's the shoulder.
Yeah.
Is it okay? Want to leave it for 5 minutes?
Yeah.
Yeah, you can.
Well, that's very simple, simplistic, good for a demo. See, if you were in the office, you'd be on the table, it's much more relaxed.
Relaxing.
I would probably start with
Gotta
that.
relax. You have to relax.
And then do some other things. She was next.
When you do the acupuncture, Betty,
Betty.
do you, so you take the pain pills too?
You can, I mean, if you're on pain pills, I don't say stop them right away, but pretty soon you'll need less and less.
Because the reason I ask is I have a daughter
Yeah.
who has been in pain since November after surgery. And she is on acupuncture, but also she's taking pain pills. So I wonder, that hers for scar tissue, the way I understand it? But she should be taking both?
Well, she should be often, but how long she been doing acupuncture?
Maybe about a month.
Yeah, she going twice a week?
I forgot, I don't know how often she goes, but I can check her and see.
Yeah.
I meant to bring her back down to New Jersey.
I mean, you could call, she could call me too and ask me.
Okay, I sure will.
Anytime. It's-
Her insurance pays for everything.
Yeah, good. It was an accident.
I think it pays too
Or
much for her.
she's state worker.
Excuse me?
The state workers are all covered.
Well, she lives in Maryland. She works for Verizon.
You tell her
anyway.
to call me.
Okay.
I have a question for you.
The acupuncture would help a person with hip replacement.
Hip replacements are still pain, definitely.
They would help.
Definitely.
Oh, okay,
And, yeah, we treat before the operation a few treatments. And if people are coming to help with the pain before they go, the operation always goes smoother because you cleaned it up a lot. By treating that area, you make circulation through the area. What is pain? Pain is some kind of inability for circulation to happen. The second you can help circulation, the energy moves the blood, it moves all that congestion. Once you have circulation, you can't have pain.
That's right.
Oh, yeah, thank you.
Okay, so the Chinese discovered the flow, the meridians for energy through the body. I'm curious, why did somebody decide that sticking a needle in a channel is going to make an improvement? And do you know what that actually does?
Yeah. There's a lot of theories, which are all going to always be theories, including aliens came and showed them. But, or an old story, somebody got hit on the battlefield in the ankle and their back pain went away. But I think it was trial and error. People, I mean, they didn't have anything. The air was very clean, the water was very pure, and people that were into meditation things probably were able to see things and start to put two and two together. But doctor here said by accident, but really, that's true, and a lot of trial and error. They saw, oh, let's repeat that. You know, there's 300 major points, but we use maybe 50 to 70 of them all the time. You see, so there's a lot of points, but you don't need them. Well, certain ones are much stronger to affect. Like we treat morning sickness, for instance, or nausea, and everyone knows about that thing you wear on your wrist. People have heard about that, but that's the point. Acupuncture point. Very successful for morning sickness.
to go with if they were interested. They have several things going on and they would like to investigate this type of a treatment. Do you have a suggestion on who they would first go to see how to begin the process of?
Well, most people have a physician, right? So they have blood work, they kind of know what's going on. So what,
So start with a regular physician first, like somebody from internal medicine or something like that? Or-
yeah, it doesn't, you don't have to anymore. We're primary now in New Jersey.
Uh-huh.
We don't need a referral. We were certified acupuncturists until about 5 years ago. They just sent us a new license. We became licensed acupuncturists. So now we don't need, we used to need a referral or diagnosis from a doctor,
yeah.
which basically meant, what'd your doctor say? He said, I have frozen shoulder. Okay, I can treat you. So, but I can ascertain a lot if somebody came in without any physicians. Sometimes they need medicine, sometimes they don't. Sometimes they need, physical therapy. If you're in enough pain, you've probably seen a doctor, and then they're not gonna be able to really treat it without painkillers. That's what they do. Or surgery, which you don't want to jump to.
Right.
So, yeah, acupuncture is really good. I'd say it fills the gap in Western medicine. The claim to fame for acupuncture was sciatica and migraine headaches. Way back in the 70s, because Western medicine still can't do much with either. And it's fast, sciatica's fast. And migraines, it depends. You cure some you can get much better. I mean, there's always about a 5 to 7% where it doesn't work with acupuncture and all the studies and everything, but that's a 92% effective rate. And it's usually about a 60% cure rate, and another 20% much better, and then 10% a little better, and 5% no change. But there's a lot of studies, 100% success rate. So, pretty effective for a lot of things.
I heard it mentioned earlier, something about the liver and something about vertigo, that kind of thing, which I'm actually experiencing that a little bit now, and I've had tests for it, and like nothing is really showing up. Oh, it's just something you have, and they give you the
Antivert.
thing, right?
They give you antivert, which puts you to sleep.
Right. So how is that related to the liver?
Yeah, vertigo, yes, mostly. We call it liver wind. So it can be external wind, which gets in the muscles and then it blocks the circulation. But it also, like Parkinson's, that shaking would be internal wind. So vertigo can be either externally produced or internally created from the person. If it only happens in the spring, then the wind exacerbates that underlying condition. But yeah, it's related to the wind, which is the pathogenic factor, which is like wind, cold, damp. They're pathogenic factors, external forces, that the wind affects the liver. So liver and gallbladder. And I have great success with vertigo. I've treated a lot of cases with that. Or to prevent it too. If people get it, they say, I don't know, can I just have a shot because I felt a little bit? And I do gallbladder points and liver points, mostly.
What shot is?
Yeah, it's about.
Hey,
5
Brother
minutes.
Matthew, do you have a question?
Did you have a
One last
question?
question.
Brother Matthew, you have a question?
Yeah, Brother Matthew.
Oh.
first.
Your primary physician give a referral to doctor?
Sometimes, some love it. There's a cardiologist, or internal doctor at the new Capitol Health. She sends me a lot of people because she's seen my patients and seen the changes. This one woman had open heart surgery. She was on asthma medicine and all this for years, and little by little, we took her scars away. She said that looks better than, a cosmetic surgeon did it. Because we just treated very superficially to make circulation through the scar, treated her lungs, chest, no more pain, no more fatigue. She's off, believe it or not, she's off most of her medicine, and she's 70-something. It's crazy and very positive. So this Chinese physician sends me a lot of patients. There's one on Quaker Bridge, he loves acupuncture. He sends me a lot of people. Some don't know about it. Some thinks, well, if you believe in it, they don't know enough about it. Now, the doctors at medical school take electives, so at least they get exposed a little to it. It's good.
Okay.
We're good? Oh, one more.
No more questions. What did he say?
Oh, bald head.
Oh,
Circulation make his hair grow back.
Go your hair? Oh, does it grow hair? Yeah, in the back. It's real good.
Thank you so much, Dr. Williams.
Thank you, Dr. Williams.